If you're abusing alcohol, pain medications, or addicted to illegal opiates and having a tough time quitting, then stay tuned as I talk with the experienced, caring individuals from Assisted Recovery Centers of America. Joining me now is Percy Menzies, president and founder of Assisted Recovery, and thank you for joining me here.
Well, thank you for inviting me.
What brought you to this place with Assisted Recovery? What was the journey to that?
I have an interesting journey. I worked for the company that discovered one of the most fascinating molecules to treat both alcoholism and drug addiction. And I was in charge of this product, and I realized that we need to develop an entirely new treatment paradigm to help people. We combine a medical approach which includes a detox and medications to block the craving for the alcohol or drug addiction, along with counseling, which includes group counseling, individual counseling, and what is even more critical is psychiatric services, because many of these people have issues that have to be dealt with. It may be chronic depression, it may be anxiety, and if you do not treat all the different symptoms simultaneously, you are setting the patient up for failure.
Well, Percy, why use medications? Isn't willpower enough?
Addiction is a brain disease. There are an actual involvement of neurochemicals in the brain, and that neurochemistry has to be somehow restored. We tell people that the new generation of medications are non-addicting, they're non-habit forming, and have to be taken for only a limited number of times.
Who is being treated here in St. Louis, and what are they being treated for?
We have patients ranging from young people who are 17, 18 years old to physicians, professionals, housewives, you name it. I tell people that alcoholism and drug addiction is an equal opportunity disease.
Percy, what is naltrexone?
It was developed by the federal government almost 25 years ago, initially to treat addiction to heroin and opiates. And now it has also been found to be very effective to treat alcoholism. The FDA approved a new form of naltrexone. And so instead of giving a pill every day, you take it as a shot that lasts a whole month. For the first time in 2005, we saw more people addicted to opiates and heroin in our clinic than alcohol.
So you're telling me that heroin is easy to treat?
We tell people that pharmacologically speaking, the easiest addiction to treat is addiction to opiates or heroin. Because think about it, it enters the brain through a very narrow channel. And once that channel, what is called the opiate receptors, are covered or protected, the heroin or opiates cannot enter the brain.
You provide round-the-clock support, correct?
A patient should not have to wait 3-4 days. We will see them immediately, the doctor sees them, and we begin the process.
Thank you, Percy Menzies, president and founder of Assisted Recoveries right here in St. Louis.
Thank you.
Appreciate it. Joining me now is John Crum, a licensed clinical professional counselor with Assisted Recoveries. Thank you for joining me.
Thank you for having me.
John, let's talk about counseling. Are you the first person they see and meet?
Yes, I'll be one of the first people they meet. I usually spend about an hour and a half with them getting a history, a social history, background of their addiction, when did they start, what was the volume, what was the intensity, and go from there. And then they assist in the development of their own individualized treatment plan that tells us where they want to be, how far they want to go, and within 6 months, what are the success indicators for them.
Privacy has to be so important to your patients. How do you deal with it?
Well, our program is extremely confidential. Obviously, people who are dealing in addiction problem don't want other people to know. We're located in the Lansdowne Medical Building, which is where we treat our individuals. It's extremely confidential. We maintain privacy at all costs to all of our clients so that no one needs to know who's coming and who's being treated at Assisted Recovery.
How important is it for people, their patients, to come and go and assimilate into the real world?
That's extremely important. One of the biggest advantages that I think we have to offer is that people can come on an outpatient basis. That means they come to the clinic, they receive the assessment by the physicians, they may spend 2 or 3 hours in the clinic the first day ensuring that they're doing okay with the detoxification process. They'll be administered medication. They'll come back the second day, and within 3 days, most of them are back in work. They're not taking 30 days off of work to go to a residential treatment facility somewhere.
Tell us, John, how can folks find you?
The easiest way to get a hold of us is by phone, and it's 314-645-6840.
And you have a fabulous website as well.
We have ARCA Midwest. They can get a hold of us at www.arcamidwest.com.